College, covering the Peterborough and Coburg campuses. And he worked there for about 10 years, counseling individual students with a variety of mental health and emotional problems, and training groups of students in mental health, first aid, and safe talk, suicide prevention. Some of you know that program as well. And recently he retired as a mental health therapist for the First Nations Inuit Health Branch of Indigenous Health Canada, serving the First Nations community of God's Lake Narrows in northern Manitoba. Wow, awesome. So again, welcome, Heimers, and the floor is yours.
Thank you. Thank you, to Isabel and Amanda, the Family Life Director for the Bronte Seventh-day Adventist Church, for inviting me. Thank you, Isabel. Isabel invited me some time ago, but I think I was in Ghana when this program was supposed to take place, doing my trip back to my heritage. But anyway, so I want to thank all of you who are joining in from the Bronte area and from surrounding areas, and my cousins are there from New York. Welcome, and anybody else from regions beyond. So what we're going to look at today is what is an anxiety disorder. I noticed the title is Anxiety and Mental Health. So what is an anxiety disorder? What are the symptoms? What are the different types of anxiety disorders? What are some of the risk factors? What are some of the things that increase one's vulnerability to anxiety? And then we're going to look a little bit at, if we've got time, look at anxiety in the brain and anxiety in the body, what anxiety does to the body, and then maybe a little bit about breathing exercises and so forth. Okay. So I understand that if you've got questions, you can put them in the chat. You can write them on the chat function, and then at the end, we'll take the questions. I'm going to speak for, well, say until I finish, about 45 minutes. We'll see if we can speak for that long. And then we'll take the questions afterwards. So since we're dealing with mental health and anxiety, I thought we would start off with a definition of health that the World Health Organization has put out. And I'm going to quote, "Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity." Okay, so it's a state of complete physical, mental, and social well-being. As far as mental health is concerned, the Public Health Agency of Canada says this about mental health. Mental health is the capacity of each and all of us to feel, think, act in ways that enhance our ability to enjoy life and deal with the challenges that we face. It is a positive sense of emotional and spiritual well-being that respects the importance of culture, equity, social justice, interconnections rather, and personal dignity. So I want you right off the bat to realize that mental health is connected with overall health. Overall health includes mental health as well as physical health. And sometimes mental health is seen as secondary and separate from physical health, but it's not. And it's important, I think it's important to note that that definition that the World Health Organization framed includes mental health in their definition of good health, overall health. So we're going to be looking at anxiety disorders as part of our focus, and I need to mention that a mental disorder is something that causes major changes in a person's thinking, emotional state, and behavior, and it disrupts the person's ability to work and carry out their usual personal relationships. Now, when I worked in in mental health, community mental health in Muskoka, I learned we would categorize a mental health disorder as with 3 Ds: disability. So what is happening to the person is disabling. It's disabling in terms of disabling relationships. It causes them not to be able to function in work. If they're going to school, it causes disruption in school. So that's the first D, disability. There's diagnosis would be a second one. So if a person has a diagnosis, we'd say, yes, okay, they've got the diagnosis and they've got a disability. They are definitely classified as a person who has a mental health disorder. And then the third D would be duration. If it's occurring over a certain period of time, we used to say 6 weeks or more. If a person is having mental health difficulties for 6 weeks or more, then it classifies as a mental health disorder. So, so with that in mind, what is an anxiety disorder? Now, first of all, let me talk about what normal anxiety is. Normal anxiety is experienced by people when they're facing stress. And when you're facing that kind of stress, the anxiety that you feel enables you to perform at your best and solve everyday problems. I was going to do this later, but I think I'm going to say it right now. I remember when I was studying for an exam, I was at Newbold College in England, and we had my roommate and myself, we had a test the following day. At Newbold, we were in rooms, two people in a room. There was no kitchen or anything in the room. It's just a dorm room. And it was about midnight, and the two of us were, my roommate and myself, Pastor Theo Stewart, by the way, we were sleeping, and we were just about to go to sleep. And he said to me, we were both about to take the same exam the following day, and he said to me, "Do you remember what was the date of such and such?" I said, well, you know what? I'm supposed to know this for the exam tomorrow, and I can't for the life of me remember. So I said to him, okay, I'll give you $1 million if you can tell me the date for such and such. we began to play around with each other. We both realized that, wait a minute, we don't know enough for this exam. And the anxiety that we experienced made us get up at midnight and study some more. So anxiety can be your friend. Anxiety is a normal feeling people experience when they're faced with losses. Maybe there's a divorce or death or job loss. And you feel anxiety because of that. Or anxiety can be experienced when you're faced with a dangerous or threatening situation. And you better believe that when you have anxiety in a dangerous situation, it can save your life. When I'm going camping in Muskoka, and they tell me that there's a report of a bear being around, I will make sure that I'm vigilant about putting food away. Those of you who've been camping, you know what I'm talking about. You got to secure your food so that the animals don't get to it, and you don't get bothered by the bears. So anxiety can be our friend. But what about an anxiety disorder? An anxiety disorder is a state of worry or apprehension or uneasiness, and it differs from normal anxiety because it's excessive and it interferes with everyday living. Like I said, if it's a disorder, it affects the way you deal with your relationships. It affects the way your ability to work. It affects those kinds of things, and that's when it becomes a disorder. It's more severe. It lasts longer. It lasts for months instead of stopping after the situation is over or after the stimulus is gone. And as I said, it interferes with work or relationships if you have an anxiety disorder. Okay, anxiety disorders are the most prevalent of the mental health disorders, but yet, let me say this: when I was working at Fleming College with the students, I think the vast majority of the cases that we saw were dealing with anxiety. Depression was a close second. So it's very prevalent. In fact, if I had some stats on it, but I think they come in a bit later on. I'll give you some stats. It's quite prevalent. Okay, so let's look at some of the symptoms of anxiety. They can be categorized in either physical or psychological. Psychological symptoms, there could be that sense of impending doom or imminent danger, excessive or inappropriate worry. When a person has an anxiety disorder, they are anxious about things that, you know, when you look at the facts of the situation, it doesn't add up. The worry that they're experiencing is unwarranted by the actual situation. So that's an anxiety. That's what an anxiety. That's a symptom of the anxiety disorder, where you've got excessive worry. There may be a fear of dying. A person may experience decreased attention or concentration, or feeling detached from themselves. Sometimes the thoughts are speeding or slowing, or sometimes a person can be easily distracted or suffer from insomnia. And then, of course, there's irritability and impatience. Those are some, or anger. Those are some of the general psychological symptoms of anxiety. Then you've got the physical symptoms. Now, some of you may be familiar with some of these, and I wonder if any of you know people who have these kinds of symptoms, physical symptoms. They could be cardiovascular, they could be respiratory, or they could be neurological, or gastrointestinal, or musculoskeletal. So let me break that down. Cardiovascular, people who have anxiety problems sometimes experience palpitations. Chest pains, rapid heartbeat, or flushing. Now, one of the things we've noticed is that people will go to hospital and say, "Oh, I've got these chest pains," and they think it may be a heart attack. And then they're checked out by the medical team, and the medical team says, "Well, we can't see anything physically wrong with this person. You know, we've checked their blood, we checked we've put them on monitors, we've checked all that, and there's nothing we can see physically." And very often the reason why a person is still
Sorry, you just got muted, Jaime. Sorry.
okay. How's that?
That's good. Thank you.
How much did you miss?
10 seconds. 10 seconds. That's it.
Okay. So I was just talking about people who go to the ER, to the emergency room, and they may feel like they're having a heart attack because they got these chest pains and things are not as they should be. They think, and then the medical team checks them out and discovers that there's nothing physically wrong that they can see on their monitors or whatever. And very often the reason is because the person is still experiencing symptoms is because they have a panic attack or an anxiety attack, okay, which have very similar symptoms. Sometimes it could be in terms of, we're talking about physical symptoms of anxiety. It could be in terms of hyperventilation or shortness of breath. You find yourself panting, right, when you're having an anxiety attack. And well, I'll say a little bit more about that later in terms of treatment. Some of the symptoms could be neurological: dizziness, headache, sweating, tingling, or numbness. Could be gastrointestinal in terms of stomach upset, nausea, vomiting, diarrhea. Some people who have anxiety issues can be experiencing those things as well. And of course, musculoskeletal refers to sometimes a person with anxiety issues can have muscle aches or pains, especially in the neck and shoulders, or they could be restlessness or tremors. Okay, so those are some of the symptoms of anxiety, of an anxiety disorder. Okay, so now we'll look at types of anxiety disorders, and this could be quite eye-opening because it kind of covers a wide area of different disorders. First of all, you have generalized anxiety disorders, which refer to overwhelming and unfounded anxiety that we talked about earlier. You know, anxiety that takes place, worry that takes place about things that really, you know, there's no factual reason why a person should be that worried about a situation that they're facing. Generalized anxiety disorders is characterized by physical and psychological symptoms of anxiety that could last for more than 6 months. And then there's general worries about money, health, family, and so forth, even when no problem exists. So that's generalized anxiety disorder. But then you've got some more specific ones, like, for example, panic disorders. I mentioned a little bit about panic already, but a person may have chest pains, they may have a hard time breathing. In my own family, a couple of members of the family have episodes where they feel their throat constricting, getting tighter. It becomes hard to breathe. And of course, they start to get worried about it. And the more they worry, the tighter the throat constricts. And so that can be a real issue. They have a hard time breathing. They may feel dizzy and sweat. They may feel like they want to throw up. They feel like they want to, they're shaking, they're trembling, they feel out of control. Or one thing that's a common feature is the person may feel like they're dying. You know, they're going to die, or they're going crazy. And so, yes, a person, so that's one of the features, one of the anxiety disorders, the specific panic disorders. So, the fear that they feel is sudden. It is a sudden onset of fear and terror. The attack develops suddenly, out of the blue, with no apparent cause. And sometimes when we're dealing with that, we ask, well, what's going on in your life, you know, that may be triggering this? And sometimes people don't realize what it is. But when you drill down and you talk to the client about what's happening in their life, sometimes there is a reason that they weren't even aware of it. It's subconscious. But then I've come across clients who they have no clue why they had this panic attack, where it came from. It just comes suddenly, and it just happens out of the blue. Okay? Another type of anxiety disorder is agoraphobia. Now, agoraphobia, most people would say that agoraphobia is a fear of open spaces, but it's actually a fear of having a panic attack or being embarrassed in open spaces or in situations. So and a person may feel embarrassed or that they're going to have an attack where escape is not possible. Okay, so that's agoraphobia, fear of having a panic attack, fear of being in a situation or a place where there's no help or escape, and a person with agoraphobia tends to avoid places where it's felt that a panic attack could happen. As I mentioned the word avoid, one of the problems with anxiety and an anxiety disorder is that people tend to avoid the thing that causes them the anxiety, and it's not helpful. So they avoid, and it makes the fear worse. They avoid, and it makes it worse. So yeah, the problem. Somebody's not muted. Okay, we'll continue. So yeah, so avoidance is not helpful, and I'll probably circle back to that a little later on, because if you're going to deal with anxiety, you have to be able to persist with certain situations and deal with them head on. Okay. Also, features other things that other disorders that are in the anxiety disorder realm. Specific phobias disorders are part of the anxiety kaleidoscope. For example, people may have a fear of snakes. They may have a fear of flying or heights. I had a client who had a fear of dogs, very, very excessive fear of dogs. And it was a disorder because, in the sense that when the person was trying to walk to school, they would see the dog in the distance and take a detour of a whole block to get away from encountering the dog. Not even just going on the opposite side of the road, but going around the corner, around the whole block. And of course, it tended to make her late for school, and that's when it became a real problem, an issue. And in the end, I remember referring her to a specialist in anxiety, in phobias, to deal with that. And by the way, she was helped. It was quite interesting. There's also a social phobia, where a person is afraid of negative evaluation by others. I've had clients students who wouldn't go to class because they felt that when they walked into class, all the eyes would be on them and people would be judging them, and and speaking and thinking negatively of them. So those are social. That's a social anxiety, fear of humiliation, embarrassment, or scrutiny by other people, and fear that others are thinking negatively about them. And it tends to develop in shy children as they move into adolescence, and it becomes worse if it's not treated well. Okay, and then we also now. I remember seeing that this one is no longer considered part of the anxiety kaleidoscope, but I'm going to mention anyway. Obsessive compulsive disorders are seen as part of the anxiety spectrum. And the reason is because people who are compelled to do certain actions and repeat them usually do so because of an underlying anxiety, and they have obsessive thoughts about a certain thing. For example, a person may be they're leaving home for work, and they get in the car and they think, oh, the door. If I shut the door, they go back. They want to test the door, make sure it's locked. They get back out to the car and they think, oh my, that door. And they go back again. So there's an obsessive thought that's recurring over and over. And the anxiety that it builds is relieved by them getting out of the car and going and checking that door again. Same with hand washing. A person may be afraid, have an obsessive idea about cleanliness. And to relieve the anxiety that thought is creating, they go and wash their hands again and again and again until it becomes an issue and the skin becomes affected and so forth. So obsessions are unwanted and inappropriate recurrent thoughts or impulses or images that the person can't get rid of. And the compulsions are repetitive behaviors or mental acts that a person will do, often to try to reduce the anxiety that they're experiencing. I had somebody, by the way, who he would count on his fingers, and he would always have to end up with the little finger on of his other hand. It's interesting. All right, so far so good. There's one other that's part of the anxiety disorder kaleidoscope, and that is acute stress disorder or post-traumatic stress disorder, which are distinguished in terms of their intensity. Okay, so a person experiences something traumatic, and they have an acute stress reaction to it. I remember I did a critical incident stress debriefing with a group of prison guards. There are about 3 or 4 of them, and a woman was amongst them. And what had happened was they had been on shift for some time, and maybe, let's say, a 12-hour shift, and it was quite long. And at the end of their shift, they were about to go off, and there was a lockdown. There was an incident at the jail, and so they had to remain in the jail in a very difficult and dangerous situation, because I think the prisoners were getting restless. And so they had to remain because they couldn't go off shift in that situation. So they were there for an extended period of time, and it caused them some amount of distress. I remember doing the critical incident stress debriefing with them, and they were, you know, some of them were in tears and so forth. And yeah, so an acute stress disorder is where a person experiences distress, usually resolved within a month after the incident. Post-traumatic stress, the stress, the distress lasts longer than a month. Okay, and then it's characterized by, you know, dreams, nightmares about the situation that they found themselves in. You know, they feel like the terrible event is happening all over again. They have trouble sleeping because of the post-trauma. So that's another feature of anxiety. Okay. By the way, I should say this, just by way of talking about my experience. When we deal with that kind of stress, acute, whether it's acute or post-traumatic, the usual treatment is to get the person to tell what happened, and that you know, ideally to tell what they felt at the time, to get it on the table and to get them to process it and look at it and not run away from it, not avoid it. Avoidance of the situation, avoidance of thinking about the situation can make things worse, you know, and then it manifests itself in dreams and nightmares and so forth. So we get them to tell the story. Now, some people don't have feeling language. Isabel knows this as a counselor. You know that some people are not able to express their feelings. And so in those situations, we say to them, okay, what happened? What happened next? Who did you see? What did you say? What happened next? And we just keep drilling down in terms of the details of what happened. Now, there is a caution to that, and that is that if a person, we have to get permission from a person to delve into that kind of post-trauma, because there is the danger of re-traumatizing the person. So we always ask, you know, are you okay? Do you want to go? Do you want to talk about this? Do you want to? Because it's going to involve going over the incident and going over what happened. Are you sure you want to do this? I remember I did this with somebody recently who had been abused by her husband over a long period of time, and it was very dangerous. Her life was in danger at times, and she said she'd never talked to anybody else about it, but she was, but I had to ask her, you know, are you sure you want to do this? Because, and I explained the dangers, and she said, no, let's do this. I need to get this out. So that's just by way of a treatment protocol for a person with PTSD, which, as I said, is a part of the anxiety disorder spectrum. Okay, so far so good. You can nod your head. I'm used to having feedback, so it's a little strange. But of course, when we come to the questions, we can definitely interact a little bit more. Okay, let me look at some of the risk factors. Let's look at some of the risk factors. One of the risk factors, or one of the features that may cause a person to be more likely to have anxiety, is gender. 16% of women are more like, 16% of women are likely to develop anxiety disorders over a lifetime. Okay, and men, it's about 9% of men are likely to experience an anxiety disorder over a lifetime. Another risk factor is if a person has depression, often anxiety can go hand in hand with it. I usually say that depression and anxiety are two sides of the same coin. If a person is depressed, a person may have anxiety and be depressed as a result, or they may be depressed and be anxious about it. So it's two sides of the same coin. Very often when you see one, you'll see the other. Another risk factor is certain drugs. For example, if you drink a lot of coffee, if you ingest a lot of caffeine, you can increase your risk of anxiety disorders, panic attacks, and so forth. Amphetamine, same thing. Cocaine, same thing. And some prescription drugs as well. There may be a family history of anxiety. Now, this is interesting because I remember I was doing what they call employee assistance program counseling for Chappelle FGI. I think it's now called Morneau Chappelle. And they asked me, they said, before I was signed on with them, they said, do you counsel children? So I said, no, I do 16 and above. That was my training. But invariably, inevitably, they'd refer children to me anyway. And I had a 9-year-old boy that was referred to me with anxiety. And the first thing I would do in those situations is I'd say, okay, I need to talk to the parents first. And what I found was that 9 times out of 10, a child with anxiety has the anxiety because a family member, usually, I shouldn't say usually, but in the case that I'm talking about, it was the mother who was also anxious and passed that on to the child. So it can be passed on genetically, it can be passed on by the environment, the type of training that the parent has given, not unwittingly, just by the way that they respond to life situations, gets passed on to the child. If they are responding to life situations in an anxious way, the tendency is for a child to also do the same thing. Another risk factor, if somebody has grown up in a home that's very strict, where every little thing that they did, the parents jumped on them for, they weren't allowed to make any small mistakes without a lot of hoo-ha, a lot of hoopla. That person is likely to grow up being very hyper vigilant about potential danger and worst case scenarios and criticism. And so there's a tendency for that to be a risk factor. Okay. All right. So I already mentioned about the strengths of anxiety. Anxiety can be your friend. If you're feeling a little anxious about situations that you're about to face, it's not necessarily a bad thing. It should motivate you to do your best in a situation to extend a little bit more energy into meeting that situation rather than making you avoid it. Okay, so don't think of anxiety as a failure or an inadequacy. It's not. It's just another aspect of our health that needs attention, and it's a part of the normal spectrum of human emotion. Okay, so the issue comes when it interferes with functioning and your relationships. That can be a problem. Okay, I've spoken for about 38 minutes so far, and I'm going to spend a few more minutes, and then we can get some questions in. I hope you have questions ready for me. But anyway, so let's look at anxiety in the brain. Now, a child, when a child is born, it's born with certain neural pathways, but those neural pathways are just paths. And then those neural pathways develop as a child begins to experience new stimuli in the environment. And that pathway, that neural pathway in the brain becomes a trail. And as they experience more and more situations, that trail becomes a path, and that path eventually becomes a road. You see where I'm going with this? As the child experiences more things, as they develop and grow into teenage adolescence, the road becomes a street, and then the street becomes a highway. And so each synapse in our brain makes connections that grow stronger over time. And whatever we think, say, or do shapes our brain. And so we know that, you know, the brain creates these pathways through the way it responds to situations. And if those pathways are made up of negative thoughts, self-criticism, and defeating messages, you know, those become highways. Those become ways in which we think about life. We tend to think about life repeatedly. And if the brain has the capacity to do that, it also has the capacity to form positive pathways. Are you with me so far? You can nod your heads. Okay. So this is the part of the presentation where I'm trying to give you a sense of hope that if you have learned to respond to situations in a negative way, you know, in an anxious way, you can also unlearn it. You can also learn how to approach new situations, scary situations. You can counteract the automatic thought that you have to avoid with something positive, with a positive way of responding. Does that make sense to you? Yeah. So yeah, the more we practice some of approaching situations with a more of a positive outlook, or challenging our automatic thoughts, the more chance we have of functioning in a normal way. And I can say more about that as you ask the questions. We can deal with that. So often the things that we're saying to ourselves in our heads in relation to situations that we're facing, often those things increase our anxiety and are not helpful to us. Okay. Now, I recently had someone who was invited to a party and said, no, I don't want to go, you know, because when I get there, I'm going to be bored. I'm not going to have anything to say. People are going to, the situations like, I can't say more, but he had a dialogue going on in his head that was negative. And there are some distortions that people have in the way that they think that increase the likelihood that they will be more anxious. So, for example, a person may pick out a single unpleasant detail about a situation they're facing, and they will dwell on it exclusively, so that their vision of reality becomes darkened or distorted. Are you with me? Yeah. So you know, so it's when we're treating a person like that, we're trying to get them to think about the way they think. We're trying to point out to them that, you know, the way that they're thinking may be a distorted way. Okay, we may point out to them that this is what you're tending to do. Another distortion. Somebody may feel that unless they're perfect, unless they perform perfectly, they're a failure. There's no middle ground. There's no shades of gray. I knew of it wasn't one of my clients, but a young lady at college who was extremely bright, extremely capable, was good looking as well. And I put that in there because sometimes people feel like, you know, people who are high functioning shouldn't really have an anxiety issue, but she was good looking, athletic. So she was one of these people who not only was good athletically, but was good academically, but she had a problem with anxiety because if she got 95% on a test, she would be worrying excessively about the 5% that she missed. Yeah. And you know, I mean, it'd be easy for me. It was easy for me to say, wow, I wish I had that problem. But there you go. There are people who, you know, and there may be one of you here that has that issue where, you know, unless you perform perfectly, You feel like a complete failure. And that is what they call a cognitive distortion. And so, counseling would help you to realize that that's what's going on, and help you to challenge the thinking that you have around that. If something bad happens once, you expect it to happen over and over again. That's another cognitive distortion. Last time I went to the house, when I stepped inside, and when I went in, someone stepped on the cat and it screamed, and it just threw me. And so I'm not going back to that house. See, that's an example of something bad that happens once, and the person is expecting that if they go back again, that it will happen again. And that's a cognitive distortion. Another cognitive distortion is people that, so for example, say you're at the checkout at the grocery store, and, the checkout lady or man gives you a funny look, or is grumpy, and you say to yourself, oh, they don't like me. That's a cognitive distortion, because what you're doing is you're mind reading, which by the way, is another category of cognitive distortion. You're mind reading, and how do you know what that person is actually thinking? Maybe they had a bad time at home this morning. Maybe things are happening in their lives that you don't know about. Maybe they were grumpy with everybody that morning, not just you. See, that kind of thing. Another feature of another cognitive distortion that anxiety sufferers tend to deal with is they ask themselves the question, what if? And it's followed by worst case scenario. What if the worst happens? And I see this quite a lot in my work. What if the worst happens? And there's that. It's a thought. We call them automatic thoughts in the business. That thought tends to jump into their head first. What if the worst? You're invited to go somewhere. You're and you're thinking, what if the worst happens? And so counseling would help that person to understand that, yes, this is the way their mind thinks. It tends to default to the worst case scenario. And the question to ask oneself is, well, what if the best happens? Or I usually, my shorthand, there's a whole, cognitive behavioral therapy, by the way, deals with this in this way, where it's challenging unhelpful thoughts. And my shorthand is, I usually say to the person, ask yourself, is there another way of looking at the situation that I'm about to go into? Realizing that I'm likely to default to the worst case scenario. So is there another way of looking at it? What else could happen? What's the best case scenario, right? So that's the kind of thing that we would do. All right. So that's to do with anxiety and the brain. We've talked about the fact that the brain creates pathways. A person may dwell on the negative, and their responses tend to be negative towards those to the things that to future events. And but we've talked about the fact that if you realize this, that if you have anxiety and you realize this, and you ask yourself the question, is there another way of looking at the situation? This can be helpful. I was going to say something about that. Oh, by the way, if you have a partner that has anxiety issues, it could be very threatening if you say to them, "I've got a surprise for you," and you don't tell them what the surprise is, because they want to know. Oh, tell me, I want to know. And anyway, so. People who have anxiety, the world is dangerous. It's scary. The potential for disaster is always lies ahead, and so they want to know. So, for example, if you have a young child who's going to a new school and has problems with anxiety, what you would do is you would try to remove the uncertainties ahead of time. So you would take that child to the school, you'd have them meet the teacher, you'd show them the classroom. So you're trying to remove as much as possible the uncertainty of the situation, because anxiety tends to predict the worst. Okay, so that's anxiety in the brain. Anxiety in the body, and I'm going to close in a few seconds. So there are physical feelings that we talked about earlier. It could be tummy aches, sore muscles, headaches. It could be things like that that the body is experiencing. Breathing issues, breathing shallow. By the way, have you noticed that if you're in a situation that's tense, you tend to find yourself breathing shallow? So like that. And so a good idea, if you're experiencing anything like that in an anxious situation, or if you have an anxiety disorder, or you feel a panic attack coming on, the best thing to do is to breathe deep. Breathe deep. Take 5 to 10 deep breaths. And in the interest of time, I should say that there are ways of practicing deep breathing. You can Google breathing exercises, and there's all kinds of exercises. I would suggest you start with a 5-minute one. It's not too long. It's not too onerous. And sometimes they have them with music accompanying them, calming music, and those can help you with exercises that to where you experience deep breathing. And in a moment of anxiety, you can use those. You can employ that to help yourself to calm down. Okay. All right. So I think I'm going to leave it at. Maybe I should say this. There are things that you can do to reduce the overall anxiety that you may experience. And for example, eating the right kind of food, avoiding caffeine, of course, avoiding dehydration, so drinking plenty of water. By the way, a quick boost from caffeine or an energy drink comes at a cost. So be careful about that, especially if you're suffering from anxiety. Try to avoid excessive caffeine or caffeine altogether. Regular exercise is very helpful to giving you an opportunity to go through life a little bit more calmly, especially if you have an anxiety issue. Now, I have a book here. Can you see that? Yeah, okay. On my screen, it's back to front, but anyway, it says The Anxiety and Phobia Workbook, okay? And it's by Edmund J. Bourne, PhD. And in this book, page 104, I think it is, he talks about physical exercises right there, physical exercise. And this is what he says. I'm going to read it for you. And I usually show my clients this. One of the most powerful and effective ways for reducing generalized anxiety and overcoming a predisposition to panic attacks is a program of regular, vigorous exercise. Okay? And what you're doing is you're helping your body to burn off excess adrenaline and so forth, and produce a disposition of calm that you can use to approach life. So that's regular exercise. Sleep. If you're not getting enough sleep, if you're not getting regular, consistent sleep, it can increase your chances of being anxious when you don't need to be. Okay, does that make sense? So regular sleep, a routine, bedtime routine, plan quiet, soothing activities just before bed. Ensure that your sleeping space is quiet, cold, and dark, and reduce your use of technology at least a half an hour before you go to bed. So don't be looking at your cell phone for the last half hour before you go to sleep. Okay, and that basically brings me to the end of the presentation, but I'm anxious to hear your questions.
Amanda, how do you want me to hang on for text vote? I think, are we reading them from the chat? Is that the way you want to do it?
Could be, yeah. I think let's start with that, and then if people want to, there's a way you can raise your hand, I think, to ask a question in the chat thing.
Okay, we have the first one in the chat says, do you find that people with anxiety are poor historians in that they do not recollect the truth? If so, how can we help here?
I don't know if they're poor historians, but sometimes there's a tendency to not see the best case scenario, to not be able to see that in a situation that things don't necessarily have to be the worst. They don't necessarily have to turn out the worst. So I wouldn't say that they're bad historians. They just don't think about situations that they're going into in the right way. Okay.
So,
all right. So go ahead.
The next question I believe has already been answered. One treatment method that you haven't discussed at all is medications when it comes to treating anxiety disorders. You've spoken a lot about all of the non-medicinal remedies. Are there times when medicine is necessary?
Yes, yeah, and perhaps my training is not in the medical field, is not in the medical or psychiatric field. So psychiatrists will dispense medication. They'll once upon a time, psychiatrists would sit down and you've got that image of the psychiatrist's couch, right? So psychiatrists used to do a lot of counseling. Now, because of factors that I won't go into, they tend to focus more on medications. Not a bad thing necessarily, but yes, the answer to the question is yes. There are medications that are helpful. Anxiolytics. Paxil is one. Ativan, or the other name for it, lorazepam, is another. Usually, a doctor will prescribe lorazepam on an as-needed basis, so you're not taking it regularly, but you're taking it whenever you feel panicky or anxious. For example, if you're going flying and you know that you're going to go on a plane trip and you know that you have anxiety on a plane trip, you might take a 0.5 milligram or 1 milligram of Ativan first before you travel, and it sort of mellows you out and you're not so anxious. Yeah. So yes, the answer to the question is yes, there are medications that doctors do prescribe. Psychiatrists mainly, or doctors anyway, would prescribe for anxiety. And I would say that if you've got an anxiety that's debilitating, it's a good idea sometimes to take that in conjunction with counseling.
Thank you. I appreciate that. There's a question that at any point in time, Alan, if you wouldn't mind just stopping the recording just as we go through some of these questions, that would be great. We had a message